Dr. Bharat Pankania, you are an expert with years of experience in communicable disease control, infectious disease management. What everyone worries about is how bad is this going to get in the UK?
We don't know, and because this is a new virus, and when a new virus starts circulating, there's a lot that we need to learn about it and then map out what it's going to do, how it's going to behave. We have seen what it's done in China, in that most people who got infected have also got better. We also hear about, people have become ill and died, but that's a very, very small percentage. And the health message, the public health message is, yes, we have a new virus circulating, but this new virus is not going to harm a lot of people. Most people will get better.
But it is more aggressive than SARS and MERS, right?
No, not at all, not at all.
It's very different, actually. The death rate is far, far lower than SARS and MERS,
correct.
isn't it?
It is. It's a little bit higher than influenza at this point in time, because we don't know a lot of the data. Definitely a lot lower than SARS, definitely a lot lower than MERS. And by the way, the SARS virus, due to public health actions, does not exist on planet Earth
How many
anymore.
died from SARS?
I can't remember. It was a small number.
But it was a 20. I think there was a 20%.
It was only 700, right? We've already had 3,000 deaths from coronavirus. So I'm at a loss to understand why we don't think coronavirus is worse.
Because the spread is much wider.
That's right.
But that's what I meant by aggression. I mean, it is spreading far faster and more aggressively, isn't it?
It is spread. It's more infectious than SARS, without a doubt.
And more people are dying.
So it generates more cases, and when it generates more cases, of course, some of them will become ill and then some of them will die. But it is a lot less aggressive if you get an infection compared to SARS.
Right, so the individual case, it's less aggressive on an individual.
Correct.
But it's spreading to far more people.
Correct.
So if it does become a proper global pandemic,
yes,
we could be looking at a lot of people dying.
Well, we reckon that the people who die, the percentage, is less than 2%.
Right, but 2% of the globe's population
is a lot
of people.
It is a lot of people, and that is why we are trying to do, and this is the containment that we have to do, which is make the number of cases as low as possible, contain it, and contain it. And if you have fewer number of cases, then fewer number of people will become ill and fewer will go and die.
Boris Johnson is being very, everything's going to be fine, we've got it under control. Is the government doing enough from what you've been seeing?
The government can only do what it can do, but now it is also up to the community. And what my advice is that please don't get infected. One way not to get infected is to use good personal hygiene. I'll come on to that in a minute.
Or washing the hands.
Washing the hands.
20 seconds.
And washing
Should we
the
be shaking hands? I mean, people have been... I've had doctors in here this morning shaking my hand.
I won't shake anyone's hand now. I think this is a big cultural
But should we be or not?
Well, you could always do the namaste from India, which is very, very spiritual.
I think people might take it weirdly if I start doing that in the street.
You never know. It will introduce quite a lot of peace and calm. My point is this. You keep your hands clean and you have to wash it frequently.
How often a day?
As often as you like.
So give me a number.
OK, I would say wash it every couple of hours, at least.
Really?
Right? Absolutely. Because the infection is from dirty surfaces or whatever to your nose, to your mouth. So you keep your hands clean. Wash it frequently. A lot of people don't know how to wash their hands.